I want to show an example of an incidental renal cell carcinoma, which is scarred down. This is a kidney. As you can see, some hypertensive damage to it. But I want to go over here. You see most of this is hyalinized scar tissue. But right in that center of that scar tissue is a renal cell carcinoma. And I'm going to go down for you to see it on a closer inspection as we look at the cells and confirm. But you can see the cells here as I go down to show you the clear cell morphology. So if I can go back to an area that shows it, that's clearly a renal cell, clear cell renal cell. The cytology is not that bad, so it would be a grade 1 for cytology, but this was an incidental renal cell carcinoma, as I demonstrated on the gross examination. I'll show the slide, the gross image again for follow-up, but this is a renal cell cancer.
This is the open section of the kidney, and right here there's some sort of a cystic lesion there. That could be just a benign degenerative cyst, but we want to make sure that it's not some sort of neoplastic cyst, but it's only 1 centimeter.
Thrombus is a good resource to study liver pathology. As you can see, these portal triads are showing some patchy scarring fibrosis, periportal fibrosis, and some patchy chronic inflammation. So it's not that bad, but you can definitely see the inflammation in the periportal area. But the acini themselves, the liver cells, are quite normal looking, except in some areas you can see some vesicular change as I go to some of those areas just to kind of highlight the morphology up closer. I might hear some vesicular change here. It's not that bad, but you can still see some vesicular change, microvesicular change. We see here that's even better right there. Just wanted to show you that it's indeed that, and oftentimes that's probably related to medication use. There's the microvesicular. Here we are viewing the microscopic image of the clot that was seen on gross examination. And when you see these lines of zones, you know you're indeed dealing with a real thrombus, thromboembolus. And you can see the hemorrhage as well. But I'm going to go closer for you to even see more details with up close. So you can see some residual wall of the vein, pulmonary artery there. And you can see some hemorrhage around there, around some. You see the vascular congestion here. But I wanted to kind of show you how we define a thrombus is that you have to see these lines of zone where you see clear areas mixed with lines of pink zones, and see the inflammatory cells admixed within the clot itself. So this was a true clot, and I'll show you the gross image as well.
I want to show this section of lung showing a nice clot in one of the minor blood vessels of the lungs. You can, minor pulmonary vein, artery rather, of the lung. So there may be some smaller clots that we'll see in the lung, but this, where the tip of the pickups or forceps is where the clot is. A little embolus, pulmonary embolus there.
And even here, this is pancreas. This is just beautiful pancreatic histology. And again, you got to use the value of the autopsy to learn about what normal pancreas will look like. But this is just clearly beautiful pancreas here, histology-wise. And as I go down, just to kind of show you up close what the cells actually look like in terms of seeing the histological morphology of the cells. But typically with autopsy, the pancreas is autolyzed, but this is well-preserved pancreatic histology, as you can see it up close, and its beautiful arrangement here. And if I keep on cruising around, I think we might hit a duct, so you can see the transition. There's a little inflammation here, but it's not that bad. And now we're getting into some ducts. Those are benign pancreatic ducts there. Now here is colon, confirming the full thickness necrosis of the colon, which is due to ischemic gangrene, where the colon is basically dying. And I'm going to go closer so you can see just on histology. There is no makeup type stuff here. You can see the ulceration of the surface mucosa, and you can see that the glands are all necrotic. And even look at the muscle. You can't make this stuff up. That's submucosa there, and then here's musculopropia. That's all necrotic musculopropia. So the bowel is completely dead, full thickness gangrene. And you can see some residual glands there that are all atrophic and necrotic as well. And look at the mucosa is ulcerated with dropout of the glands. That's classic for ischemic necrosis.
On palpation, this area here is very firm and matted. I suspect there's going to be some sort of pelvic tumor here. It may be in the intestine. As I was showing this, looks like some sort of hemorrhage right here in the some part of the transverse. But I think there may be some sort of tumor here. The ovary is right here, and that, if I can get my finger into it, right here, that ovary is normal looking, so I don't think it's ovarian, but the uterus and the bladder are all in this area here. So it may be some tumor either from the colon, that looked like maybe tumor there, in the intestine there. So I'm thinking it may be some sort of obstructive colon cancer in this area here.
Finally, I'm going to show this these features partly in an unknown way, and I want to see if anybody can come up with a diagnosis. But notice this stuff here. This is brain matter. And I'm going to show you, you just can't make this stuff up. Some people are saying some of this is artifact, but it's not. Because if you notice, I'm going to go to other areas to show that this is not artifact. And you can see even the intracellular edema within the neurons themselves as well. But I'm going to peruse around fast because I don't have a lot of video time. But you can't make this stuff up. This is just so neat. That feature there. And I'm going to show you the gross feature as well. A gross image of the brain. But I'm trying to get to an area that shows, look how the nuclei of the neuron or edematous. Okay, so I'm going to show the gross now. You tell me what you think the diagnosis is. I routinely, during autopsy, take scrapings of the rib to look at bone marrow samples, and you can see a little osteoporosis here. But I'm going to show this as well as an unknown, and the questions I want you to answer is I want you to guess the patient's age based on the bone marrow tissue that we're showing here, and I'm going to go down and show you even closer view of the bone marrow cells, and you can tell me, do a little description for me in terms of what you see and whether or not this bone marrow is normal. Okay, so I'm going to peruse around here, but let me go back to that other area because it has a little more cellularity for you to see the details of the cell. Let me see if I can go down even lower. Oh sure, I might be able to get some even closer view of the bone marrow cell. That's pretty good. Alright, what do you think? Okay, you can't get no better than that. That's good morphology there. Here's a better view of the bone marrow elements as I peruse around slowly so you can get a better feel for the actual cell constituents within the bone marrow. Very nicely done here. I'm going to raise the light a little bit just to see if we can, I don't know if the light's going to come up any better than that, but that's some pretty good stuff there. Let me see if I do this. But anyway, a good morphologist will be able to determine what I'm trying to show here. Let me see if I can put it back into focus here. Sorry, I'm going in and out, but that's alright. I just want to see if you can make heads or tails of what we're looking at in this bone marrow, which I think a good morphologist will be able to not make an excuse and diagnose this bone marrow. Okay, look at that, beautiful cells that needs to be developed. With regards to the last video posted, I'm going to put it in perspective for you. So this is a section of lung, and as I go down for you to see more specifically what I'm trying to show here in this lung section, and you tell me what you think. Alrighty, what do you see as it relates to the previous question posed, questions rather, in terms of that bone marrow? What do you think about this area of the lung? Alrighty, it's a nice section, nice image, and you should be able to come up with a specific diagnosis about this lung. Okay, see if I can get into one good area. Well, all of this is good, but anyway, some obviously better than others. Okay, right in here. See those cells there. Okay. And I have to show this image for teaching purpose. You know, still today, there are some physicians and even pathologists who don't know how to define a lymph node. This is a peribronchial lymph node, and I'm going to tell you what we use to define a lymph node. First of all, look at this area right here. Let me zero in on that area here. Right there. You see the little wispy fibrous tissue right there? I wish I had a pointer, but anyway, it's a wispy fibrous tissue right there that surrounds the surface of that lymph node. That's called a lymph node capsule. Once you get a capsule, you know everything inside that capsule is lymph node tissue. And it's a good idea to go down and then study what normal lymph node morphology would actually look like. And you see mainly some lymphocytes, some histiocytes, vascular tissue, and in this case, you can see some pathologic anthracotic pigmentation. So this is an anthracotic pigmented peribronchial lymph nodes with histiocytes and reactive lymphocytes.